And now the Health Cabinet Secretary Dr. Deborah Barasa on Wednesday came under intense scrutiny in the Senate as lawmakers questioned the government's preparedness in implementing Taifa Care and rolling out of a social health authority.
Senators put the Cabinet Secretary on the spot over the withdrawal of private and faith-based hospitals from the Social Health Authority, the exclusion of civil servants from private healthcare facilities, and the persistent funding challenges threatening the success of the program.
The grilling came amid growing public outcry over the efficiency of SHA.
Health Cabinet Secretary Dr. Deborah Barasa faced a tough grilling session in the Senate on Wednesday morning over the troubled rollout of the new national medical scheme,
whose only interest with health matters is a budget allocation to your ministry. All policy-related matters are implemented at the county governments, Mr. Speaker. You can hear the kind of questions that senators are asking. Some of them is purely on account of the fact that this ministry has failed to interact with this House in the manner that it ought to be.
Senators questioned the government's preparedness to implement Taifa Care, citing funding gaps, staffing shortages, and the withdrawal of private and faith-based hospitals from the Social Health Authority.
Can the Cabinet Secretary standing here before the Senate today confirm to us that there is no family in this country that has planned a harambe for this weekend to get payment for a loved one to obtain health care, including that baby Ariana, Honorable Speaker?
Just go on record and say that as a country we were not ready for the rollout of UHC. You cannot tell the sick nation that you are putting money to build hospitals, you're looking to recruit staff. That should have happened before you rolled out UHC. So just go on record, be clear on that.
Kitui Senator Enoch Kwambua led the onslaught, accusing the government of rushing the universal healthcare coverage program without proper infrastructure and personnel. Senators further challenged the Cabinet Secretary, demanding answers on why civil servants were being turned away from private hospitals due to unpaid debts by the defunct National Health Insurance Fund.
If she's aware that civil servants are not getting treatment or denied treatment in private institutions, and now because it is because of the debts that the government owed through NHIF and SHA.
When we were closing down on NHIF to go to UHC, we had X number of facilities. At the time of rolling out, we had increased the number from X to X plus 1,000. We had X number of doctors. We increased the number from X to X plus 20,000. Those are the figures that are expected. Not literature, Mr. Speaker. I thank you.
In response, Dr. Barasa assured senators that the Health Ministry was in talks with the National Treasury and other government agencies to settle outstanding dues owed to private and faith-based health facilities.
Human resource for health, again, it's a journey. Once we have our health financing, once our patients are being seen, once the products are reaching to the facility, then the resources continue to accrue, then we can have even more human resources coming in and again supporting us in the implementation of UHC.
Senators also poked holes into the new benefit packages under the Social Health Authority. For Prime Edition, I'm Gladys Mongai.